Okay, welcome back. This is Dr. Vermiglio again. We're going to continue on our discussion. This is part 3 on speech recognition and noise disorders. And we're going to discuss this thought about speech recognition and noise results versus pure tone threshold testing results. Recall that an assumption has been made that pure tone threshold results in the form of pure tone thresholds or pure tone average is related to the ability to understand speech in the presence of background noise. Actually, a number of investigators have noticed that some individuals will have normal pure tone thresholds, and yet they complain that they're struggling to understand speech and noise. And this condition has been called by many names, including psychogenic deafness. Psychogenic deafness means that the complaint of difficulty understanding speech and noise from the patient is all in their head. It's not real because the pure tone threshold test is the gold standard. Therefore, they actually don't have a problem if the pure tone thresholds are normal. It's also been called normal fragile ears, the auditory inferiority complex, auditory disability with normal hearing, obscure auditory dysfunction, the King-Kopetzky syndrome, named in part for Dr. King, who was a member of the Royal Air Force back in the 50s, and something called a central auditory processing disorder, according to Price and colleagues in 2010. Central auditory processing disorder is a very highly controversial disorder, and I'd be happy to talk to you about that disorder if you have any interest in that. Okay, so speech perception is arguably the most important function of the auditory system. According to the AAO-ACO, a measure of hearing ability should include a measure of speech perception and noise. Even so, hearing conservation programs and the determination of hearing impairment, according to the WHO, the AMA, and the NIH, NIDCD, are based on the ability to hear pure tones in a quiet environment. You should understand the significance of the conflict between a pure tone threshold basis for the determination of auditory function and the arguments against this philosophy found in the research literature. Speaking of the research literature, we're going to discuss briefly a study that we had published in 2012 on the relationship between high frequency pure tone hearing loss and the hearing and noise test thresholds. So here's a graph, and we're going to plot the results for what we call the hint composite score. So this is our measure of speech perception and noise. This is the maximum pure tone threshold between ears. So this is a measure of the pure tone thresholds. It's actually the worst threshold between the ears for each of our subjects. I think there's like 215 subjects for this study. So that's the y-axis, the x-axis, and the more negative the hint composite score in dB signal to noise ratio, the better the performance. So the more negative the score, the better the performance. And so this is a good performance. This is a poor performance. And so these are the hint composite scores, and the groups are sorted by the maximum pure tone threshold for illustration. A signal to noise ratio, all that means it's the level of the speech signal minus the level of the noise. And the score is actually a composite of the thresholds across 3 listening conditions that I won't get into. But basically what a signal to noise ratio is, if you have a 0 dB signal to noise ratio, that means the level of the speech and the level of the noise are the same. If you have a positive signal to noise ratio, that means that the level of the speech is above the level of the noise. If you have a negative signal to noise ratio, that means the level of the speech is below the level of the noise. Okay, and then here's our groups. These are our markers for the groups. So folks with normal pure tone thresholds, right? And normal in this case is minus 10 to 15 dBHL. Slight loss, mild, moderate, severe, and profound. So if there is a relationship between the pure tone threshold, the worst pure tone threshold, and the hearing and noise ability, we should see the scores for the when the max pure tone threshold is very low, meaning it's within normal limits, then we should see the scores bunched up over here in the corner, signifying that they're related to very good speech and noise ability. But what we see for individuals with normal pure tone thresholds, where the worst threshold is 15 dB HL, we actually see this wide range of performance from -4 dB SNR to about -9 dB SNR. And that's a very wide range of thresholds. So let's continue on. Here are the folks with a slight loss, the folks with a mild loss, the folks with a moderate loss, and the folks with a severe loss. And if you look at the range of thresholds, they're actually not too dissimilar. And actually, when you do the analysis, the statistical analysis, there was no statistically significant differences found between any of these groups versus the group with normal pure tone thresholds. And then we had a few subjects in the profound group. So this tells us you can't use the audiogram, at least the maximum pure tone threshold between ears, to predict speech and noise ability. This is contrary to the whole basis of using the audiogram as the gold standard for hearing ability when hearing includes speech perception and noise. So the range of thresholds from the poorest performance to the best performance is a 50% range of speech intelligibility. And according to Humes, a pure tone average of 5, 1, 2, and 4, less than 20 dB HL indicates no or very slight hearing problems in quiet and in noise. And all these folks had pure tone thresholds 15 dB HL or less. So these data do not support this idea. And of course, this is the basis for the World Health Organization grades of hearing impairment. Here's a really interesting study by Holder et al. All of their subjects had normal pure tone thresholds. They're plotting across different listening conditions. So this is a condition where they're listening to sentences without any noise. Then they're listening to sentences that are presented 10 dB above the noise, 5 dB above the noise, 0 dB, which is the same level of the noise, or when the speech was below the noise at 5 dB and -10 dB. These are the scores in percent correct for a test called the AZ bio test. And if you look at the range of scores, also all of the subjects had normal pure tone thresholds. All of the subjects had normal pure tone thresholds. And look at this crazy wide range of performances, right? Now, this is across a wide group of ages, but still, all of these folks have normal audiograms, and we see a 60 percentage point range in speech recognition and noise ability. So if we took this person and this person out to a noisy restaurant, we would predict that this person would understand 60% less of the conversation relative to what this person is perceiving over here. Very interesting. There is a study by Charlie Lieberman et al., and they looked at a group of people with normal pure tone thresholds. Look, here's their audiograms. One group had a very high risk. That was the high risk group. These are folks that had exposure to noise, mostly musicians. Of course, I'm sure the musicians would be upset if you said that their music was noise. And then this is the low risk group. So these are the folks without a significant history of exposure to high levels of sound. And across the audiometric frequencies, there's no significant difference between the thresholds, right? But when you look at their self-report rating of their ability to understand speech and noise, the folks in the high-risk group gave a poor subjective rating of their ability to understand speech and noise than the group that are in the low risk. So these are the folks without significant noise exposure. And then this is interesting in the annoyance of sounds. The folks in the high-risk group, those, again, they have normal pure tone thresholds, but they have a history of noise exposure. These folks reported greater annoyance to sounds than the folks in the low-risk group. And then they actually measured, so these were subjective reports, right? They just asked them on a questionnaire what their impression was. And then in this part over here, they actually gave a score for their perception of speech in background noise. And we find that the group who had a significant history of noise exposure, they had a statistically significantly poorer score than the group without that significant history of noise exposure. So this was in noise at 2 different signal to noise ratios. Excuse me. This is in reverberation, a similar configuration results. And so this is pretty interesting. All these folks have normal pure tone thresholds, but the group that's exposed to noise, they actually have statistically poorer performances for speech perception in the presence of background noise. Notice that the performance of or rather the scores for their ability to understand speech in a quiet environment are the same between the 2 groups. So again, the World Health Organization says better ear pure tone average less than 20 dBHL represents no impairment and no or slight hearing problems in speech perception and noise. So a comparison of the WHO better ear pure tone average versus speech recognition and noise thresholds. We're going to talk about this. And again, the more negative the speech recognition and noise threshold, the better the ability to hear speech and noise. So here's some data fresh off the press. It was actually not off the press. The article's in review, but I'm going to share this with you guys anyway, because I think it's really interesting. So 381 subjects, right? And we looked at the relationship between the speech and noise ability and the WHO better ear pure tone average. So if we can use the WHO better ear pure tone average to predict speech recognition and noise ability, we should see a statistically significant correlation, right? But look at the correlation is only 0.067, and it's not statistically significant. And so this tells us that actually the assumption by the World Health Organization is false. You actually, according to these data, you cannot use the WHO better ear pure tone average to predict speech and noise ability according to these data. And then the data over here, these are just the participants who had partial audibility of the hint stimuli. In other words, they couldn't hear all the speech and they couldn't hear all the noise. Once you just look at these individuals, then look at the correlation coefficient is a 0.73, it's statistically significant. And look at the data, they're lined up in a line, you see a nice linear relationship, and you can actually predict the speech and noise performance from the WHO better ear pure tone average. So can you predict speech and noise ability from the WHO better ear pure tone average? And the answer is yes, but for a subset of subjects who have partial audibility of the speech and noise. So it's the audibility of the subjects to hear all of the frequency components of the speech and noise stimuli that's driving this high, relatively strong correlation. Okay. Also, this number line right here, 20, this separates the folks with a mild to moderately severe hearing loss according to the WHO guidelines from folks with no hearing impairment. And notice that according to the WHO, all these folks have no impairment, but according to these test results, all of these folks right here have a speech recognition and noise disorder. We see the sensitivity and specificity of the WHO better ear pure tone average for the detection of a speech recognition and noise disorder. And it's not looking good when you look at all the subjects. For the WHO better ear pure tone average, only correctly identified 16.7% of the participants with a speech recognition and noise disorder, SRN, speech recognition and noise disorder. But for this other group of subjects with partial audibility of the speech and noise stimuli, the sensitivity is now 84.6%, which is pretty decent. So it all depends on the audibility of the stimuli, and for most of the subjects, the WHO better ear pure tone average is not a good predictor of speech recognition and noise ability. Let's talk about a few common disorders of the outer ear, middle ear, cochlea, eighth nerve, auditory brainstem pathways, and the central auditory nervous system. So here's a problem that you can encounter. The ear canal can be impacted with wax. And that wax, if there's enough wax in there, it's going to act like an earplug, and it's going to reduce the level of the sound, going through the eardrum, through the ossicular chain to the cochlea, and the signal going over to the brainstem pathways in the cortex will be significantly reduced. So here's the Q-tips, you know, nice and soft, fuzzy Q-tips. You know, how could they hurt anybody, right? But on the box, it says, if used to clean ears, stroke, swab gently around the outer surface of the ear without entering the ear canal. Do not put that in your ear canal. Warning, use only just directed. Entering the ear canal could cause injury. Keep out of the reach of children. So this is a normal eardrum looking down the ear with an otoscope. So when your physician or audiologist looks in your ear canal, this is what they're seeing. That's actually the handle of the hammer, or the malleus, or the manubrium of the malleus. This is the eardrum, and this is the lining of the ear canal. And when folks use Q-tips to try to clean the wax out of their ear canals, a lot of them can actually shove or plunge the wax down and create a wax plug, which can be problematic. And when it seals up the ear canal, it can cause what we call a conductive hearing loss. Now that will be temporary until the wax is carefully removed. So Q-tip use may cause cerumen to become impacted. Cerumen plugs may create a conductive hearing loss that should say may interfere with communication. In some cases, removal of the earwax might be painful, especially if the wax adheres to the eardrum. Q-tip use may also damage the lining of the ear canal. The use of earplugs in a damaged ear canal may result in further injury and bleeding. And I've seen this. Q-tip accidents may result in injury or even deafness. Did you know that? You can have deafness by Q-tip use. So this has been known to happen. And Q-tip used improperly could puncture the eardrum. There's some blood there. And if it enters the what's called the round window or the oval window over here, it can literally kill the ear, and then the person will become deaf. And there have been reported cases of this, which is kind of scary. Okay, so there's eustachian tube dysfunction may result in fluid in the middle ear. So if you have a problem with the eustachian tube, that's the tube that goes from the middle ear to the back of the throat. If that's not opening and closing, you might get a sensation that your ears are plugged, as we say. That can create a negative pressure, which may cause fluid to build up, and that can cause a hearing loss. Otitis media with effusion, that's otitis media with fluid in the middle ear. It's an infection of the middle ear, may be secondary to eustachian tube dysfunction. And otitis media may cause a conductive hearing loss. Chronic otitis media may be treated with pressure equalization tubes, and the purpose of a PE tube is to drain the fluid from within the middle ear. So here's the eustachian tube, this is the middle ear, this is a PE tube, and the goal of the PE tube is it's surgically inserted, the fluid will drain out, and so you can clear that fluid out and then restore a more normal hearing ability for the patient. Obviously, we talked about the noise-induced hearing loss, which can result in damage to the structures in the inner ear. So here's the nice, healthy outer hair cells before exposure to high levels of sound. And then here's the outer hair cell stereocilia after exposure to high levels of sound, and things are not looking good, right? So if these stereocilia are not there, they're not functioning, then that signal is not going to get to the eighth nerve, which is mostly connected to the inner hair cells. But recall, if the outer hair cells are not functioning properly, then the inner hair cells will not receive this signal. So exposure to high level or loud sounds, a one-time exposure to a very high level sound may result in a profound hearing loss. And I've seen this with some of my patients. Exposure to ototoxic medications, some of the drugs used to fight cancer can actually cause a hearing loss. Aspirin in very high dosages are ototoxic. They can cause a hearing loss. Just getting older can cause a hearing loss. Most of these conditions will cause a high frequency hearing loss where speech may sound muffled. And a lot of these patients will say, you don't have to yell at me. I can hear you. I just don't understand you. And that's because they're missing the high frequency voiceless fricative sounds in speech. An acoustic neuroma or a vestibular schwannoma is a rare disorder that is found on the vestibular branch of the 8th nerve. Okay, and symptoms may include an asymmetrical hearing loss, unilateral tinnitus, ringing in the ear, usually on one side, dizziness, pain, or pressure. The acoustic neuroma may be surgically removed. The surgery may cause single-sided deafness, unfortunately, and there's the risk of facial paralysis on one side because the facial nerve is also in the area where that tumor is located. It may exist in the presence of normal pure tone thresholds. It may be screened for with something called an auditory brainstem response, and it may be diagnosed using an MRI. So here's our ear canal, the middle ear, the cochlea, and then here's our 8th nerve. And then, oh my gosh, look at this huge tumor, right? So this is an acoustic neuroma right there. And this is an acoustic neuroma in a scan. All right. So you don't want this. You don't want it close to the brain. You don't want this invading the brain. It can be life-threatening. Now, these grow very slowly. And before you go thinking that you have one of these, they're extremely, extremely rare. Okay, you can also have a tumor in the cortex, and it may cause a hearing loss that may be found using pure tone thresholds. However, a central auditory nervous system or CANS lesion may exist in the presence of normal pure tone thresholds. So you can actually have a tumor in the presence of normal pure tone thresholds, which is odd because of the temporal lobe. That's where the sound is processed. That's called the auditory cortex. So you think, well, it's the auditory cortex. This is getting all the nerve fibers coming up from the cochlea. If you have a tumor there, surely that's going to affect the pure tone threshold test. It's actually not true. It doesn't always affect the pure tone threshold results. So a CANS lesion in the presence of normal pure tone thresholds may be detected using specialized tests, such as something called dichotic listening, filtered speech, time compressed speech, and speech recognition and noise. These are specialized tests that are sensitive to the presence of a temporal lobe tumor. Let's talk about a few case studies. Hey, I used to work as a technician at a place called the Arco Oil Refinery in Carson, California. This is in Southern California, south of LA. And they had a hearing test truck. It wasn't the Reliable Mobile Hearing Testing Company. This is just for illustration. But they had a test truck that came in, and unfortunately, the technician, the driver, parked the truck very close to a very noisy piece of equipment. And then all the workers had to come into this truck and take these hearing tests. So you can imagine taking a hearing test when you're right next to all this noise. A lot of these workers failed the hearing test. So then they hired me to come in. I was working on my master's degree in audiology at the time, back in the glory days when all you needed was a master's degree to become an audiologist. And they hired me to retest a ton of workers because they had failed the hearing test. So here's a case. A worker fails an annual hearing test. He had serial audiograms, meaning multiple audiograms. And over time, it revealed a rapid decrease in hearing ability in one ear, right? The worker was counseled to obtain a medical follow-up to rule out medical problems. That, I told the guy, I said, you know what? Your hearing is falling apart in one ear. You should go get a medical examination to figure out why your hearing is falling apart. Now, I didn't use the word tumor, but his response was, oh yeah, someone else told me that I might have a tumor in my ear. My physician looked at my ear and said, I don't see a tumor. So the worker was counseled to see an ear, nose, and throat physician. So the worker said, oh yeah, someone else told me that I might have a tumor. My physician looked in my ear and said, I don't see a tumor. Okay, so picture this. The physician looks in the ear with an otoscope. What are they looking at? They're looking at the ear canal, right? They might be able to see the eardrum. Are they going to see this tumor? No, recall, this is all bone. This is all encased in bone. There's no way they're going to find a tumor by looking in the ear canal. So that's what I told him. I said, sir, you actually have to see a specialist. You have to see an otolaryngologist or an ear, nose, and throat physician. And I hope he followed my advice. I don't know. Here's case 2, again at the Arco Oil Refinery. A young worker fails the annual hearing test. When questioned about his exposure to high sound levels, he reported that he was a truck driver. When questioned about hearing protection, earplug use, he reported that according to the state regulations, truckers were not allowed to use earplugs. Now, this is really interesting. He had an asymmetrical hearing loss, and if I remember correctly, the hearing loss was greater on the left side, which is where they rolled down the window so that he's listening to more of the road noise and the engine noise as he's driving the truck. A young guy, and what happens is they have to take a hearing test every year in order to keep their professional license to drive a truck. If their hearing loss gets bad enough, they will lose their driver's license to drive a truck, and they lose their job. So their job was actually causing them to lose their job. So several employees from the trucking department all had evidence of asymmetrical hearing losses, and the loss was always on the left ear. The manager of the trucking department reported for a hearing test. He also said the state regulations prevented truckers from using earplugs, and I talked to him about it. So I went right from the Arco refinery that night. I went to the public library in Lakewood, California, and I said, "Where's your?" This is before the internet. "Where's your DMV code?" And they showed me all these volumes of the DMV code. And I looked up the regulations about earplugs for truckers, and guess what? They were right, but it was 7 years prior. The information was old. So 7 years prior, the regulations had changed, and the truckers were now allowed to use custom hearing protection. But they're being told by the bosses at Arco that the truck drivers are not allowed to wear hearing protection. So the vice president of the refinery was notified. I contacted him, and I said, this is not good. You have a class action lawsuit that's brewing here. So you need to contact the trucking department and get them updated on the regulations and get your truck drivers fitted with custom hearing protection. So let's see, case 3. This case demonstrates how the hearing and noise test may be used to evaluate the effects of protective headgear. So 42-year-old male, and we fit him with these different a helmet, earmuffs, and earplugs. We wanted to answer the question, how do these things affect the ability to understand speech and noise? Here's his audiogram. So normal pure tone thresholds, right? The worst threshold was at 25 dBHL at 6,000 hertz in the left ear. Blue, red is right, blue is left. And then here's the hearing and noise test conditions, where the speech and noise is coming from the front of the patient, or the speech is in the front, the noise is off to the right. That's called the noise right condition, or the speech is in the front and the noise is off to the left. That's called the noise left condition. And so these are our hint conditions. We also have a condition where the speech is delivered without noise. And this is our range of normal normal performance, right? So that's the 95th percentile. That's at the top end of normal. This is the bottom end of normal, the 5th percentile. This is, if the marker is over here, it's above normal limits. If it's down here, it's below normal limits. If it's at the midline right there, that's the average performance of the 50th percentile. This is within normal limits and above average performance, below average and within normal limits over here. So that's how you interpret this graph. So these are the hint scores when our patient or our research subject was wearing a motorcycle helmet. And you can see this is interesting. So with the helmet, his ability to understand speech and quiet went down a little bit, but it's still within normal limits. Same thing is true for the noise left condition. The front condition, his threshold was actually below normal limits, which is interesting. And with the helmet, it's roughly the same. But when the noise was delivered from the right side, the speech is in front of him, his ability to hear with the helmet actually decreased. You can't get this information from the pure tone thresholds. You can only get this by using a speech and noise test. Here's with the earmuffs, and you can see with the earmuffs, for the noise front condition, it really didn't change speech perception ability when the noise is coming from the front, but when the noise is off to the side, it actually, the earmuffs actually made speech communication worse. And of course, in quiet, we expect it to be worse because that's what the earmuffs are designed to do, is to reduce the sound level. These are using foam plugs. A similar thing, noise front, thresholds, we don't see a change, but when the noise is off to the right, the earplugs actually hurt the person's ability to understand speech and noise. Here's an interesting case. This person had complaints, actually a 6-year history of difficulty hearing speech and background noise. And he reported that his hearing loss negatively affected his social life. So he was struggling to hear speech and noise at social gatherings. His pure tone thresholds were all within normal limits. Looks like a little bit of a notch here. So maybe he had some noise exposure going on. His speech reception threshold in the right ear was within normal limits. It's at 15 dBHL. So that means that he could understand speech when it's presented at a very low level in the right ear and the left ear. And then when the words were presented at 45 dBHL, when a series of words were presented at this level, he could understand 100% of the words in the right ear and 96% of the words in the left ear. So for all intents and purposes, this looks like a normal hearing ability. But remember, his complaint was difficulty hearing speech and noise. And here are his hint scores. In quiet, he's within normal limits, but in the presence of background noise, all of his scores are below normal limits. That confirms his ability to, or his complaints about difficulty hearing speech and noise. And the patient may benefit from counseling regarding something to improve what's called the signal to noise ratio. He may also benefit from an assistive listening device that improves the signal to noise ratio. There are a number of devices out there that will do this. And this has been called obscure auditory dysfunction. But according to these results, the auditory dysfunction is no longer obscure, although its cause remains unknown. And in this case study, you have a 35-year-old male with congenital hearing loss on one side. He was an applicant for a law enforcement position, and he was seeking to improve his hearing enough to be considered for the job. Look at these thresholds. The left ear was within normal limits, and look at those right ear thresholds. Yikes. So he's missing a lot of high frequency information. Now recall that the WHO bases their determination of hearing impairment only on the better ear pure tone average for 500, 1,000, 2,000, and 4,000 hertz, right? So according to the WHO, this hearing configuration represents no impairment. So here's, again, the hearing and noise test. The right ear was the bad ear, the left ear is the good ear. And then, so imagine the bad ear is over here. And in this condition, the one good ear is getting hammered with all this noise and the speech is coming up from this direction. Whereas on this side, the noise is going towards the, excuse me, the bad ear. We have something called the head shadow effect that's actually blocking some of the noise getting to the better ear. And look at these test results. So the good ear is the left ear. When the noise goes to the left ear, look at the score. It's very, very poor. It's well below normal limits. But when the noise is going towards the right ear, which is the bad ear, you have that thing called the head shadow effect, which is blocking some of the noise getting to the good ear, which is the left ear. And the ability to understand speech and noise is actually within normal limits. And then when the noise is in the front, it's the score is still below normal limits. Look at the quiet score with no background noise. The score is within normal limits. So the WHO would say that this person has no difficulty hearing speech and noise. But if you look at the speech and noise results, when we have a spatial separation of the speech and the noise, it tells a completely different story. So again, the World Health Organization says the better ear pure tone average, less than 20 dB, which we have here, represents no impairment. And our results from the hint test actually tells us a different story. Here's some intervention strategies used to prevent and control noise-induced hearing loss. And I'm going to stop the recording and we'll pick up here.